Hello everyone, welcome to today's Facebook Live with GBMC Healthcare. Today we're talking about comprehensive weight loss and the ins and outs around sugar addiction. Let's welcome our guest, the Medical Director and Bariatric Surgeon of GBMC's Comprehensive Obesity Management Program, Dr. Elizabeth Dovec. And we want to hear from anyone who's watching. Please don't hesitate to ask us your questions. Welcome, Dr. Dovec.
Thank you for having me, and we apologize to everybody out there for some of our technical delays, but we are up and running and we're going to have an amazing event.
We do. All right, so let's talk about you and why you decided to become a bariatric surgeon.
So I think we all got into medicine to really positively impact the lives of others. And I think one of the biggest epidemics right now we're facing is obesity. And obesity is a really devious, complex, difficult disease. And I get to see people who struggle with it on a daily basis. But what I also get to see that it is possible to reverse the negative effects of obesity, and that possibility fuels my work. So I get to lead the most amazing life, and I'm really passionate for this subject matter.
And you know, it seems like the epidemic is increasing. Why do you think?
I think the epidemic is increasing because of sugar, and that's what we're going to talk about today. And I think it's about the way we think we should eat and the way we're trying to get healthy, and it's the wrong information. And so today I hope to set the record straight and really make a positive impact on how some people view the fuel that the food that they eat as fuel, and to really lose some weight and get some results this time.
Do you think it's hereditary?
I do. I think obesity is hereditary. I mean, there's always going to be somebody that you'll go out to eat with and they eat so much more than somebody else, and they'll say, I don't get it. I can eat anything and you can't. And it just stinks sometimes, I think, for some people. And I also think your genetics are a crystal ball into your future. So if you see maybe your mom or your dad or your uncles or your cousins or whoever, you know, struggling with obesity-related conditions, that might be on the road to you. And so I think sometimes it's important to recognize that and to make some really impactful changes.
Let's talk about those changes. One of them that many people do, count calories. Do you encourage your patients to do that?
No, do not count calories, everyone. I think that's the biggest misconception in how to lose weight. Everybody comes into my office and they eat too little. They will say, you know, I don't eat much for breakfast. I often skip lunch. I might grab a bag of chips here and there. Dinner, I have my sensible dinner. But then all of a sudden that's going to catch up to you. By trying to restrict your calories, a lot of times you're restricting your fuel and you'll end up craving fuel like glucose, and you'll want that sugar, and that's the problem. So actually I say forget trying to do calorie restriction, because all calories are not created equal. And focus instead on what type of calorie it is rather than the amount of calories.
I understand. Okay, typical Americans, it seems like more and more, you know, we're really increasing that sugar intake and consumption per day. How much are we really consuming each day on average?
So right now in 2019, people are consuming an average of 73 grams of sugar a day on average. Now there are many, many people out there, actually 25% of them, who are consuming more than 150 grams of sugar a day. If you look back over the years and the centuries, we used to consume less than a gram a day and then less than 15, and each year we're consuming more and more and more. The statistics are showing that the more sugar we're consuming, the more we're gaining weight, the worse the obesity epidemic. If we continue to increase this at the rate we're going in just 20 years, so by 2040, 95% of Americans will be overweight or obese if we don't change our thinking and the way that we look at food.
But let's talk about, you know, the calories. I feel like some of them are, and even the sugar, some of them are hidden, right?
Oh, yes, sugar is hidden everywhere. Sugar is in common things. Like you might think, okay, if I add sugar to my coffee, okay, that's obvious. But sugar is also in ketchup, in breads. You think that whole wheat bagel you're eating is a healthy option? Guess what? It would taste like cardboard if they didn't add sugar to it. So bagels have tons of sugar. You name it, pastas, candies, and most importantly, the biggest culprit of sugar is in the drinks we consume. Sodas, fruit juices, sports drinks, alcohol, mixers. If you consume sugar with drinking it, it's the fastest way to gain weight. So that's the big thing you should avoid. So the first step, if I were to give anybody a tip, is to try to limit your sugar liquid consumption as a step one.
Okay. All right, and then, there are some people that unfortunately, like, it's an addiction and it's hard to break. And so they need your help. What do they turn to?
So it is an addiction, and I think it's because, not because a person is weak, or they don't have willpower. It's more that sugar is part of the fuel that keeps us going. So it's a basic survival mechanism to need to crave sugar to keep going. I mean, 95% of our civilization, we were hunters and gatherers.
Yes.
And we didn't have this overabundance of food. Now everywhere you turn, there's a McDonald's, there's Arby's, there's Burger King, you name it, there is sugar, and sugar hidden in everything and everywhere. So I think a lot of us, once we go down a road, we need to understand that it is addicting. And actually, sugar is 8 times more addictive than crack cocaine, and sugar is even more addictive than heroin. We all know about heroin, it's bad. If you saw somebody shooting up on the street, you would be a little bit concerned.
Right.
But if you saw somebody drinking a Pepsi, you wouldn't think anything of it. And I am a recovering cherry Coke addict. And I myself used to drink over 2 liters a day because you know what else? We are all really good at validating our reasons why we deserve it.
Yes. Oh, yes.
You know, I had a bad day. I had a good day. I'm not that big. It's not that many calories. But when you keep going with those things,
Yes.
the truth is you're killing yourself by some of the things that you think.
What does sugar exactly do to the body?
So there's different types of sugar. So there is, I'm not going to try to get too technical, but there's monosaccharides, and there's glucose, and then there's fructose. So when you combine the old-fashioned table sugar, it would be a combination of the two. But now we're seeing a huge increase in fructose, even things like high fructose corn syrup. And so what those things do, when you consume more fructose, the way the body handles it is, it will actually turn to going and storing it into fat cells. So it's not fat that's making us fat or overweight, it is the sugar. And sugar is, the way it's metabolized is the same way that alcohol is. And sugar in consumption is the #1 cause of fatty liver disease, which goes on to end-stage liver disease. And sugar is the #1 reason why people need a liver transplant. It's not because of alcohol abuse, it's because of sugar abuse.
All very eye-opening. We do have a question, so we wanted to ask that. This is from Joan. What causes sugar cravings?
Sugar cravings, again, are your basic survival. If you are not eating enough, if you're not consuming enough protein, if you're not eating 3 meals a day, you need to eat breakfast, lunch, and dinner. You need to eat a lot of those meals. You need to eat enough that you're filled up and satisfied, so you're not picking and grazing, so that you don't find yourself with that feeling like I need a little something at the end of the night. It almost typically happens, the kids are in bed, the day is over, it's the habit that you have, I'm gonna go and chill on my couch, play on social media, hopefully watch this event, and then what do? You get your bag of things you think are healthy, like popcorn, or pretzels, or chips. That's my trifecta of doom. Those things are like slider foods. They slip right down, and you never really get filled up or satisfied, and you just keep going and going and going and feeling, you want that feeling of satiety or fullness, and you're never gonna get it, and you're just gonna keep craving it and craving it and craving it. The more you do, the more you want. It's just like any drug. It is toxic and it is addictive, and it's hard to stop.
Does weight loss surgery help with this?
It does. This is the thing that people are often surprised of. The minute you have weight loss surgery, your tastes change. We don't know why that is. It's been very widely studied. But instantaneously, things are too sweet. So right when you wake up from surgery, if you try to drink something, even something that has no sugar in it, like Crystal Light, will be too sweet. And next thing you know, you just don't even want it. You can't tolerate it. It makes you a little sick even. And then your cravings will minimize and you will no longer be addicted. So once a patient gets to that point where they no longer consume it, because you do almost have to go through withdrawal of sugar, like any drug, you have to get away from it. And once that happens, we really teach you at our program how to not go back to it, because that's so important. Because once you go back, it's like tempting fate. I think I could do heroin in moderation. Said no one ever. You can't.
Right,
you just can't.
No. I understand that y'all have a big event coming up in December.
We do. We have a very exciting event, and this is the big announcement that I'm so excited to share with everyone. A lot of you know out there that we do an annual reveal party every year. So this year on Thursday, December 12th, 2019 at 6:30 p.m. at Martin's West, we're going to do our biggest extravaganza ever. Oh. We are planning on having, I'm hoping for over 2,000 people to come and share all around the greater Baltimore area, heck, all around this country, all around the world. I want to come together and I want obesity to unite us, and I want this surgery and the results and the transformations and the inspiring stories to really capture everyone and show people that you can do this. You can change your life. You can kick this sugar addiction. You can have amazing results, and you can get healthy for good. So we have a trailer video, and I think we're going to show it now. Okay. I have a big thing, and I'm going to post it after this Facebook Live for people to RSVP.
And so we're going to play that now, so stand by for this announcement. Hey now, it's a party, y'all. That is so exciting.
Thank you.
So you can, I guess, go to the information on the website?
So to get started with our program and to be part of this amazing movement that we have here at GBMC, just go to gbmc.org/weight-loss and do an information session. You can do it right now. It's online. It's only a few questions. It's quick. And I hopefully will see you in 2 weeks, along with my partners, Dr. Gustavo Bello and Dr. Timothy Friesen, to get started. And you'll get to be a part of all of it. So this year's theme is the word why. Okay. And I think I wanted to bring that up today because to do something so overwhelming, like kick an addiction, to get healthy, to lose massive amounts of weight is so hard. The first step in doing something overwhelming is always the hardest. However, if you focus on why do you want this? Like, why do you want to live? Like, why are you passionate about it? If you start with your why, I think you'll see that you'll finish with something that's absolutely incredible. So at this year's reveal party, and our whole theme of our practice is to help people to focus on their why and never lose sight of it.
Well, certainly with a video like that, I don't think they will, and certainly an event like that as well. Thank you so much for joining us, for all of your information and for your passion about what you do.
Thank you. Thank you for having me.
And thank you to all our